Joining me now, Dr. Joe Thompson, former State Surgeon General, former Chief Health Officer, and the current and long-running Director of the Arkansas Center for Health Improvement. Good to have you back.
Glad to be with you.
Good to see you. You doing well?
Yes.
Good.
Very well.
All right. You have an event coming up on Monday, December 3rd. It features former Governors Mike Huckabee and Mike Beebe. It's the 20th anniversary of the Arkansas Center for Health Improvement. Happy birthday.
Thank you.
Anniversary. Thank you. What's going to happen on December 3rd?
We've got an exciting event coming up on Monday in partnership with the Clinton School of Public Service where it's a trifecta, really. Governor Hutchinson's going to welcome the audience and the two former governors to say a few remarks. We're going to give out 2 Tom Bruce Awards. These are Lifetime Achievement Awards for individuals that have contributed to the state's health. And then we're going to have an armchair conversation with former Governors Mike Huckabee and Mike Beebe about health care policy and what it takes to make a governor a health care governor.
And you get to moderate that, which good luck to you
intentionally it says moderation, not refereeing.
Let's talk about former Governor Huckabee's legacy in terms of health there. 2 big things really stand out to me. His handling of the tobacco settlement, which you and I actually worked on together and all that, and the smoking ban has been a very prominent thing. I was in Mississippi a few months ago, and the second I walked in, I smelled smoke, and I was like, I had forgotten how bad that feeling was, to be honest with you.
Well, you know, I think there's some other great contributions. Our Kids First came under Governor Huckabee's tenure. The Tobacco Settlement Act, where we're still the only state that has all of those monies going for health programs. The Clean Indoor Air Bill, which you mentioned, and aside, the elder Senator Hendren, now Representative Hendren up in Northwest Arkansas, he came up to me in the Capitol and says, Dr. Joe, I know I didn't help you and I might have hurt you, but you were right. Because he had gone across into Missouri in a restaurant with a smoking section, and he came back and said, there's no such thing as a non-smoking section. So, you know, I think under Governor Huckabee, the state made a lot of forward progress. We started on the obesity efforts for childhood obesity. We've got yet to turn that corner. That's going to be a long-term challenge.
We still rank pretty low in terms of our overall health and in obesity.
Our risks, both on tobacco use and obesity and physical inactivity, are among some of the highest in the nation. And we're not going to solve this on the healthcare side unless we solve it on the health side first.
Yeah. Talk to me, too. There was a new report that came out this past week that did show the number of uninsured children has risen a little bit in Arkansas. What's driving that? That
is a concerning trend that we saw yesterday. For over the last decade, the number of uninsured children has been going down nationwide and in Arkansas. And nationwide, statistically significant increases were noted this week. Arkansas's were not statistically significant, but they were in line. I don't think we know yet what's going on there. There are some issues around the noise that's in the insurance world about the instability of the Affordable Care Act and the negative conversations that have been, you know, on the airways for the last 5 years. We've also got some other things that are concerning the substance abuse opioid epidemic and some things that could be affecting parents' actions that are in the best interest of their children, and they may be getting diverted from some other causes.
Let's talk about former Governor Beebe's healthcare legacy. I think you obviously have to put private option in that category of the thing that he's most known for. Arkansas.
Yeah, I think that's the thing he is most known for. From conversations with him, and I think he'll relay, I think he's most proud of our efforts to change the way physicians in hospitals are paid, the payment improvement effort to improve the quality and the efficiency of care. Obviously, the expansion services there. We put a tobacco tax in place that put the first trauma system in place across the state also, you know, under his tenure. So, I mean, the state has been known for stepping out over the last 2 decades in ways that most other states in the South and many across the nation have not.
Healthcare innovation, I believe is what they call it there. Let's talk about Arkansas Works, because we've seen the work requirement come in. There is the possibility that a lawsuit that is pending could change the outcome of that. What in your estimation would happen if the state loses that lawsuit?
Well, I think it's important to put Arkansas Works and the current model in context. Under Governor Huckabee, we had a first of its kind 1115 waiver to take Medicaid dollars and partner with small businesses to help low-income workers in those businesses get health insurance. That was called the AR Health Networks. The private option was another 1115 waiver, and now Arkansas Works is a modification of that to have the community engagement. These waivers are actually waiving a federal rule by the Health and Human Services Secretary to do an experiment. To do an experiment, it is a test to say, is this a way to improve the system? Governor Hutchinson has navigated the political waters to maintain the expansion. part of that is this experiment with community engagement. And we'll need to see whether it works or whether it actually causes harm. In the terms and conditions that the state got from the federal government, it clearly states you've got to monitor for and hold harmless individuals.
Is there enough data out there to make that determination?
Not yet, because we're only 3 months, 4 months into individuals being totally subject to the work requirement, but I think there is a need to evaluate it, and there'll be a requirement by the feds to look at the outcome. That outcome really has two parts. A successful policy for a work requirement would have an individual get a job or increase their income from their job, number one, but number two would have them also engage and get private health insurance. You have to have both, improved salaries, higher earnings, and private health insurance for this work requirement to be a success.
Last question for you. Do you foresee anything? We've got a divided Congress now heading into January there. Anything related to the Affordable Care Act that you think will happen in this upcoming Congress?
I think much is going to be determined by the open enrollment process that we're in now. If states have fewer people, sicker people enroll, then the insurance markets across the nation are going to become much more unstable, and there will be demands for action. People in Arkansas don't really recognize it. We have the most stable and the lowest increases of any state in the nation. So we've been pretty protected from this, but other states are having 30, 40, 50% rate increases each year, and the politics around that started having privately insured people affected.
Why have we been more stable here in Arkansas?
We're more stable because of the experiment of buying Medicaid, with Medicaid dollars, buying private insurance, which made our insurance market much more stable. We put a big guaranteed purchaser, Medicaid, in the middle of the insurance marketplace, and it made the private insurance carriers much more comfortable offering coverage and stability in rates of the coverage that they offered.
All right, he's Dr. Joe Thompson with the Arkansas Center for Health Improvement. Always good to catch up with you.
Thank you.
Thank you. All right, back with more right after this.